Was medial cuneiform, is that
Yes.
correct? Okay. So like Dr. Leonard said, kind of finding first met navicular tube. You can kind of, I know you guys haven't learned joint mobilizations yet, but if I stabilize here and I can feel like she has a lot of mobility between her first met and her medial cuneiform here. Each cuneiform goes with each corresponding metatarsal. So if I'm doing mobilization here, I feel that base, I just move my way laterally. I can kind of get a little wiggle in her second metatarsal. And again, I can feel the joint line right here. So I know that this is cuneiform and navicular is a little bit bigger over here. If I move on to third met and keep moving laterally, this is going to be lateral cuneiform or third cuneiform, depending on how they're calling it. And then cuboid is going to be your bigger bone over here. So you have navicular and cuboid are going to be back here, and then cuboid articulates with your fourth and fifth metatarsals. She doesn't have quite as much. Yeah, she does. I just need it to be a little bit more proximal to stay on cuboid. So cuboid is going to be here. You have the tuberosity of your fifth met right over here, which is where your Peroneus Brevis muscle is going to come attached to. So if you have your patient plantar flex and evert, you should see that tendon coming down right to here.
What is that called again?
The tuberosity of the fifth metatarsal. Conversely, going to the other side, another way you can confirm you're on navicular, a navicular tube, go ahead and dorsiflex and invert. And then that tib anterior tendon is coming down maybe like just distal to that, sure this is, go ahead and lift the big toe. So this is going to be her extensor hallucis longus tendon, and then her tib posterior tendon is.
If you curl your toes and bring them up, then it should just be tib anterior.
Mm-hmm.
Oh.
Yeah, so she's got a big one there. And then go ahead and relax. And then on the opposite side, you have your lateral malleolus coming down from the fibula. You can do the same thing, kind of tracing around here. And then we have ligaments. So from the lateral malleolus coming down inferior and usually slightly posterior is going to be Calcaneofibular ligament. So go ahead and relax, patient. And then if I invert her, I should feel that ligament tauten up right here. Moving more anteriorly, you have your ATFL, which is your anterior. You can kind of bring yourself back to neutral. Anterior tibiofibular ligament, which is going to be one of your more commonly sprained ligaments. So again, I'm going to work my way around her lateral malleolus. And then for this one, I'm going to try and find it. I think it's right here. And then when I plantar flex and invert, I should feel that tendon, or not tendon, ligament pop up into my finger here. I'm not sure of actually. There it is, right there. So I was a little bit lateral initially. And then there's tendons running through there also, so you could have her do a contraction. And then I feel the tendon contracting medially to my finger. So I know that I'm on the ligament because I didn't feel any contraction there. And then on the medial side, you have your deltoid ligament, which kind of breaks into a bunch of different, like 4 different ligaments kind of bundled into one. So if I come inferior on the malleolus and slightly anterior, and then I evert her, I feel more of like a, this would almost be more like your MCL, where it's like that fatter, kind of thicker ligament, whereas your ATFL and your CFL are more like your LCL, where they're like that little skinny ligaments, where deltoid is going to be a bit broader, more like a thicker band. Does that sound like a good place to stop?
Yes.
Yes.